are the one, two, three things that you are predicting that has a high likelihood of adopting within healthcare in the next 5 years, technology or otherwise? How do you see it changing?
This labor shortage isn't going away, especially the clinical labor shortage isn't going away. So I'm specifically interviewing and looking for technologies that are going to address that, reduce the need for labor. It used to be we were worried that the clinicians or the nurses were going to respond and say, "You're trying to take my job." Now what they're saying is, "Help." It's a completely different conversation. Automation in any area, especially, I believe that we are going to start thinking about our infrastructure as a platform. And I know that that's a buzzword, but all the elements that a platform has, if we start thinking about our internal IT infrastructure as that, we should think about it that it can grow and shrink as we need it. It should be addressable via APIs, our infrastructure addressable via APIs, so that we can grow it or shrink it or re-provision or all those things via code. Because where security is going right now, we're going to need to do that. You almost have to think of your infrastructure as a platform, a code block that is malleable to what you need to do, because I think healthcare is going to continue to change. We're going to continue to be asked to do things we haven't done before. Anywhere that somebody is where we should take healthcare. So those are two areas. Then the other area, I don't know how it's ever going to get funded. The whole social determinants of health, that's the hardest thing. I think it's going to take those, for lack of a better term, more well-off, scaled health systems to build the models and then show the rest of us how we can do it. And maybe even develop the core technologies and give it to us to do, because there doesn't seem to be funding for it. We need leaders to get out there and innovate and drive down the cost so the rest of us can do it. We've got to drive health and not continue to rely on sick care moving forward.